Hey guys, this is Michelle from Virtual Hand Care, and in this video, follow along with me as we do a real-time finger, thumb, and wrist exercise routine. This is a very gentle exercise routine for somebody that had a thumb spica cast on. Now maybe that thumb spica cast came off and you are ready to start moving. After your cast comes off, you always want to make sure you get approval by your doctor to start these exercises or any kind of exercise program. Go ahead and get comfortable. Usually what I recommend is to prop your elbow up on a table, up on a pillow, a towel, something that is comfortable so you can really just kind of focus on some gentle, isolated movement. Now, commonly with a thumb spica cast, your fingers can get stiff, especially your index finger, because depending on where the thumb was casted, the index finger might have had a hard time being able to move. You might have actually been able to move the other side of your hand a little bit better. So what we want to do is really just start on a little bit of light movement in those fingers. So what we want to do is first just work on trying to go into a light hook fist. And so what that is that's where we're just working on bending the DIP and PIP joints of the fingers. So we're looking to come down and straighten all the way up. Now I know there's no way right now that you can go into full motion. If you're very new out of the cast, you may not be able to go this far, and that's okay. You really just want to start at a comfort level that's right for you. So we're just working on trying to get a little bit of that hook fist going. And as you can tell, as we go into that hook fist, we usually get a little bit of thumb motion, because for some of you, the tip of the thumb actually has a little bit of a attachment onto a slip of the index finger here. So you might actually notice you get a little bit of thumb movement that way. But as you feel like you get a little more warmed up and you're doing a couple of these, you really want to think of trying to just kind of lightly get that thumb tip just to kind of come down with your fingers, and then straightening back up and come and hook down and straightening back up. Now I'm not forcing this, I'm not grasping really hard, I'm not trying to force down, I'm just gently going down to what my fingers and my thumb will let me do at this time. And each time you come back to this exercise, it will probably feel better and better and better. So you want to do about 10 to 15 of these. Good. Then what we want to do is we want to just kind of warm up those fingers and that thumb in more of an open and closed position, abduction and adduction. So we're going to work on bringing those fingers together and the thumb together if you can. And then we're going to work on opening just to what you can do and bringing those fingers together and opening just to what you can do. So together and apart. Nice and slow. Good. Excellent. Now what you want to do is just relax those fingers. And now what we want to do is when you relax the fingers and relax the thumb, typically those fingers get a little closer to the thumb. So what you want to do is just work on touching the index finger to the thumb if you can. And back open, because you already worked on a little bit of that open, so we're going to go back to that, and we're just going to work on trying to touch the index finger and back up and touch the index finger and back up. And it's very important to make sure that you do open the fingers after each one of these, because it allows you to go through that full range of motion. And if that's hurting the wrist a little bit, you can always kind of support the wrist and the hand as you are working on the fingers. You just don't want to block the fingers from moving. Really, what you're eventually wanting to do is try to make a nice circle right here, an O. You may not be able to do that. When you touch the index and thumb, this might be all that you can do. Going into a circle might take you some time, and that's okay. And then if that feels okay, then you would go to your middle finger, and you'd want to do about 10 of those as well. Now, for many of you, you might not even be able to touch the middle finger, and this is as far as you could go, and that's okay. That's a good place to be at, because you know you will only continue to improve from there. And you can continue then to each of the other fingers, trying to touch the other fingers, even though you can't. You're still getting a little bit more thumb mobility because you're just trying to go across the palm and trying to go to those other fingers. And then you would want to try the small fingertip. That's going to be probably the last one that you can touch, and that might take you quite a while. And just coming out of a Thumb Spica cast, you're probably not going to be able to touch that small finger for a while. But you would always want to start with the index and then slowly work across your hand to try to loosen up the fingers, but also loosen up the thumb. Okay, so now let's turn our attention to that wrist a little bit. So relax those fingers as much as you can, relax the thumb. And then what you're looking to do is we're gonna start just doing a little bit of gentle wrist. And you're gonna lightly try to bend that wrist forward. And as you go forward, your fingers will kind of gently open up a little bit, as well as your thumb. And then you want to bring that wrist just back a little bit into extension. Now you may only be able to move in a very small motion, and that's okay. What you're looking to do is just move a little bit gently back and forth to start. And then what you can do is hold those motions a little bit more for a few more seconds. So when you go back into extension, you hold a couple of seconds, and notice when you go back into extension, the fingers come a little bit closer to the palm, and the thumb even comes a little bit closer to the fingers as well. And then you go forward and hold a couple of seconds as far forward as you can go. And again, those fingers might pop open a little bit. The thumb might feel like it moves open just a little bit. And that's called a wrist tenodesis. What we're looking to do is just use that natural way of moving our wrist to kind of get our fingers and our thumb a little bit more mobility. So again, holding a couple of seconds going back, holding a couple of seconds going forward. So you want to do about 10 to 15 of these. And you can hold a couple of seconds going back and hold a couple seconds going forward. And you just want to stay within your comfort range of around like a 2 to 3 out of 10 pain. You definitely don't want to push it too hard, especially if you're just starting out with your motion. Okay, and then our last exercise is working on wrist side to side, and you're gonna feel a little bit in the thumb and the fingers with this as well. So just like before, how we open those fingers up and that thumb up, go ahead and get in that position if you can. But now what we're gonna do is we're gonna go into a side to side motion with the wrist. So we're gonna be moving that wrist a little bit into what's called radial deviation and then into ulnar deviation. And again, just do what you can. You can position your hand this way. If this is not very comfortable for you though, you can turn your hand more in a neutral position this way. And sometimes that can be a little more comfortable. Sometimes even just resting down on a table or a surface and just going side to side can be a little more comfortable as well. Just keep in mind that ulnar deviation and radial deviation is not a big movement. We don't have a ton of that motion, and it's not as much as our flexion and extension. So it is a smaller movement, but it can be kind of sore because you are moving everything in that wrist. Your thumb, you have several thumb tendons that actually cross the wrist too that you might be feeling. So just do what you can. And you would want to try to do that a couple of times a day. You can do 10 to 20 repetitions of each of those exercises, to the fingers, to the thumb, to the wrist. It does definitely take some time, so be patient. However, be consistent with your exercises and stick with it, and you should continue to see your motion improving. Now, I hope you found this video helpful. If you did, please give it a like and hit that subscribe button below. And while you're at it, check out these videos here where you can find more exercises for your fingers, thumb, wrist, and arm. Thanks for watching.